Hi everyone, and welcome back to Tiny Matters with Dr. K. I am Dr. Kutso Sebetela, a pediatrician, a mom, and a storyteller. November marks World Prematurity Month, and this, a journey I know very well, as the NICU is a place that's very close to my heart. Every year, thousands of babies are born earlier than expected, tiny, fragile, and in need of urgent specialized care. And for the families of these NICU babies, this place can feel scary, terrifying, overwhelming, and deeply isolated. I know this, not just as a doctor, but as a mom. My quadruplet boys were born at just 28 weeks. Even with all my specialized medical training, nothing could have prepared me for the journey of the NICU. Suddenly, I wasn't a pediatrician anymore. I was a mother. I stood beside incubators, watching heart rate monitors, waiting on test results, listening to the hum of machines keeping my babies alive. I remember the sterile smell, the fear, the way time moved differently, from one blood gas reading to the next, from 1 millimeter of expressed milk to the next hopeful gain in weight. I also remember the people. The nurses who called me mommy every morning that I walked in. The doctors who took time to explain things warmly and gently. The lactation consultant who taught me how to express milk and taught me to never give up. That time in the neonatal ICU reshaped me. It taught me that no amount of medical knowledge can prepare you for the vulnerability of watching someone you love fighting to stay alive. So when I speak about prematurity, I speak about it not just as a pediatrician, but as a mom who has walked this road. And my hope today is to bring comfort, clarity, and encouragement to families who may be facing it too. And to help me in doing that, my guest today is Dr. Sandra Motsisi, a neonatologist who's helped hundreds, if not thousands, of premature babies and their families walk this journey. Thank you so much for joining us.
Thank you for inviting me.
So what are the most common reasons that babies would get admitted to the neonatal ICU?
Okay. There are quite a few reasons why a premature baby will be admitted to the neonatal ICU, but I'll just touch on a few. The commonest reason would be that the premature baby is born with immature body organs. And the first one, which would give us a problem once the baby is born, is the lungs. So one of the commonest reasons why a baby is delivered and then needs admission to ICU would be having breathing problems. And there is a wide range of problems they can have, but the commonest is difficulty in breathing. That's one of the reasons they've been in ICU. The second problem, still related to breathing, is forgetting or stopping to breathe, which is called apnea. Mm-hmm. So premature babies have a problem where they can have times when they actually just stop breathing, and because of that, they then need support in the neonatal ICU. Another reason is that they are born so small and their birth weight is so small that they also need to be admitted so that we allow them to grow and be big enough to go home. And the other problem is because they are so small and their systems are so immature and the functioning is not normal, they can't control their body temperature. Mm-hmm. So they tend to then drop their body temperature, and that is a problem because it increases the risk of this baby not making it. Mm-hmm. So we then tend to admit them if they have temperature instabilities as well into the neonatal ICU.
Sure. Okay. So, I mean, it sounds like everything is small. Everything is underdeveloped, yes, right? Yes. So as much as our hearts want to have our babies with us, I think when you see your baby like that, you actually realize there's no choice. They just need to be in the hospital. Yeah, yes, which is like quite traumatic. Like I say, quite traumatic for families as an experience. Yeah. Can you explain the differences in the because there's like different categories of prematurity, right? So a baby who's like 500 grams is not the same as a baby who's 1.5 kilograms. It's not the same as a baby who's 2 kilograms, for example. Can you explain the difference and kind of what parents can expect with the difference?
Okay, so we'll first start by a normal pregnancy. A normal pregnancy can go up to 40 weeks. And then from 37 weeks, completed weeks, to 40 weeks, that's a term baby. So anybody who's born before 37 weeks is then categorized as a premature baby, meaning the delivery of this baby occurred before the time the baby should have been delivered. So if you look at the numbers, and these numbers that I'm saying, 37 weeks and 40 weeks, that's the period of the pregnancy, so the gestational age of this baby. So a baby who's closer to 37 weeks then does a little bit better than one who's further from 37 weeks, and that's why the importance of the gestational age. So we categorize them into late premature babies. So late prem would be a baby between 34, 36 weeks. So those babies are closer to 37. So they'll tend to do a little bit better than the others. And then we have very premature, as they call it, and those are the babies who are below 32 weeks. So as you see, we're moving further away from the 37 weeks.
Yeah.
And then we have the extreme prematurity, which are the babies that are less than 25 weeks. And unfortunately, some pregnancies do end at as early as 25 weeks. So the problem becomes organs are developing and getting ready to function closer to 37 weeks.
Yeah.
So the earlier you come out, then your organs are not completely formed. There are some areas in that organ that are still incomplete, or some organs are not ready to function fully. So the smaller you are, the more premature you are, the more immature your organs are. So those babies, when they come out, will struggle. And all organs will struggle. And then the closer then they come to 37 weeks, like your 36-weeker, that baby does a little bit better. They still struggle because the organs are still not fully mature, but they do a little bit more better than the baby who's born smaller and 32 weeks.
Okay. All right. You mentioned the lungs, right?
Yes.
That the lungs are the thing that we often see the earliest, right? So the baby comes out and they're really small and they're struggling to breathe. What are the other challenges that babies tend to face in the neonatal ICU, the premature babies?
Okay. So we fondly call them our premature babies, drama kings and queens. And I think it's a way of not looking at as a negative thing and saying it's a challenge, but saying every day there's something this baby must overcome.
Yeah.
So we call them drama kings and queens because they are so unpredictable. And on any given day, something can go wrong. So the basics behind it is that all the organs, literally from the brain to the heart, to the lungs, to the gut, are not yet, skin, immune system, are not ready and mature to be out of the body, out of the mother's uterus and functioning. And then fortunately, this baby is now out. And when they're out, they need to survive outside. So if I take it from the brain, the vessels in their brain are so fragile that it's so easy for those vessels to rupture. And then that baby can have what we call an intraventricular hemorrhage or bleed in the brain. They're at risk of that. And then with that comes forgetting to breathe, as we call it. So it will be a normal day in ICU, you have your bag and you'll be ready to leave, and then one of your prems decides to stop breathing, unprovoked. So they can have apneas. And then moving now to the lungs, they can be breathing okay, and then the next minute they're working hard. Or they can be delivered and they are working hard and they need support right from the beginning. And another thing is they may need oxygen, extra oxygen support while they're in the ICU. And then with the heart problems, they're not specific to prem babies. All babies can be born with possible heart abnormalities. But with the prem babies, there are some structures in the heart that are meant to close once you take your first breath. But with the prem babies, for them, then that sometimes doesn't occur, and some connections that should close then stay on. And then you can think things are going okay, and then you're feeding, and then they'll vomit. Because that gut is not ready to start absorbing food. Okay. And then also things like temperature that I've mentioned, that they can have temperature instability, so they need an environment that's warm, that keeps them their temperature at a normal range. And then other things like how the systems work, like the sugars and all of that, they can have their sugar going either up or down. So like I say, they are little drama kings and queens. every day they're trying to get through something. So you could be eating for 4 days and then on the 5th day they vomit. And then you take a break and then you start again. So that's just to mention a few of the challenges that they can have.
Yeah, sure. I always say tiny but mighty, hey? And I mean, when you say all these things, it's quite overwhelming. It's quite scary. And I think like again, as a parent, you know, it's very scary, all the things that could go wrong, right? And I imagine as medical care is getting a little bit better, that more babies are surviving, you know. What are some of the things that have improved outcomes for babies? Because I imagine if you were born 60 years ago at 25, 26 weeks, your chances of survival were just so much lower than what they are now. What do you think those things are that have improved the outcomes for our babies?
Okay. So yes, true. If you were born 50 years ago, we didn't have some of the technology, some of the interventions, some of the medicines that we're able to give right now. So we are fortunate that in the time that we are practicing, we have so many things that can support how we manage babies. We have improved the care of mothers, and that's where it starts. So a healthy mother will give us a healthier baby. So we have improved the care that we're giving to mothers, meaning we have better outcomes of their pregnancies, even though the baby's born premature, but the health of the mother is a little bit better. And then the other thing, we've improved facilities where these mothers are delivering. So we are privileged now to even have specialized facilities where we have neonatologists who are specifically trained to take care of a newborn baby. So the child is not seen by a general practitioner or just a general pediatrician. They have someone who's specialized in a newborn care. So just the care and the skill we have has helped. And then on top of that, to assist the specialist, we even have things such as during the pregnancy, if we see that there's a threat in an early delivery, there are drugs such as steroids that are now given to mothers to try and help the problem that I've mentioned, that the lungs are the biggest problem. So they'll try and give this mother steroids to try and help and see if these lungs can be a little bit more mature and ready to be out there and breathing. Okay, so that's what we can do while the mother's still pregnant. And then once the baby's delivered and we couldn't stop the early delivery, there are things like caffeine, not the coffee that we drink.
I'm like, all this talk about steroids and caffeine.
Not the coffee that we have in the morning, but their own special kind of coffee. So it's called caffeine, and with that, we try and help. The caffeine has a lot of functions, but one of the functions is to help the baby to breathe, because like I said, one of the problems that they have is that they forget to breathe at times. So the caffeine tends to help that.
Okay, I think caffeine helps me to breathe as well.
It also helps us to keep up with the baby. So what's important in NICU is to have your own cup of coffee before they have their caffeine, so you can keep up. So things like that, and then just improved services, facilities, and skill. So few things, and even with the caffeine, we also have things like a surfactant, which is what they are lacking in their lungs. So we have that now that we can actually administer to the babies to help how the lungs. So these are just a few of the things, but these are the things that have made a big difference in the outcomes of these prem babies.
Yeah, thanks for that. And I think kind of knowing about it beforehand, and knowing now that, you know, we're having this conversation, that actually everything that's there is helping my baby to do the things that he or she would have ordinarily done, but is just not able to do right now. In terms of the machines?
Okay. In terms of the machines, so like we say, breathing, I'll keep repeating breathing because that's one of our biggest problems. So we have, previously we had the big ventilator machines, which ventilator machines are the machines where we put a pipe down the airway and then connect it to the machine, and that's how we help the baby breathe. But now we've had non-invasive ways of helping these babies breathe, meaning we don't have to put the tube in. We just have an interface that we put on the outside of the baby on the nostrils, and then that helps them breathe. And that machine is called a CPAP. And that's been a great machine for us because as soon as the baby is delivered, we can put them on the CPAP machine. It gives pressure there's air that's going into the baby, and then helps the baby to breathe a little bit easier. So it makes their work of breathing a little bit better. And with the CPAP, then we couple it with the surfactant.
Okay.
So then we'll administer the surfactant into the lungs and then the CPAP, and together that then helps the baby with, number one, their deficiency of surfactant that they had, and then now even how the lungs are functioning, these immature lungs, the CPAP then gives this extra help for every breath not to be so hard. Because if we leave the baby to struggle with every single breath, they get tired.
Yeah.
So this support then helps them to then breathe a little bit easier so that they don't get so tired. And with all of that, then it helps then that baby that doesn't work, the baby doesn't have to work so hard. And then as the lungs are getting a little bit stronger and a little bit better, then we'll take them off the machine. Another thing that has also helped us is incubators. So temperature is a big problem.
Yeah.
And with every drop in degree for a baby, basically every degree that a baby gets cold, it puts them at risk of actually, it puts us at a chance of losing this baby, basically. So temperature regulation is very important in a pregnant baby. And incubators are great with that because we can artificially control a baby's temperature. So we can put them in this, some people call it a container, but it's a device that we put the baby inside, and then we can control the temperature that's inside. And basically try and recreate what was happening in the mother's womb. Where the temperature stayed constant. It didn't matter what the weather was like outside, the temperature stayed constant. So that's what we do with the incubator. We put the baby in it, we set the temperature to a certain level, and then that helps this baby who can't regulate their own temperature regulate their temperature. So those are just a few of the equipments that we have that have improved the outcomes of babies in NICU.
Yeah, those are great insights, and I'm so grateful for them, because I imagine, again, as a mom, again, I had, the experience of being a doctor and being a pediatrician, so I knew what everything was when I walked into the ICU. But for a lot of parents, you walk in and your child is connected to all these machines and you're seeing all these names everywhere. There's all these leads, and there's this tiny human being at the end of it all who just feels so far away from you. With time and modern technology, I think machines have taken care of a lot of this stuff, right? But there's certain things that parents can do, right? And I think a big one of them is Kangaroo Mother Care, right? Kangaroo from the name, like how a kangaroo holds their baby. But what is it, and why is it so beneficial to mothers or fathers and the babies?
Okay, all right. So I'm going to call it Kangaroo Care because I want to remove just the mother aspects to it. I think we call it Kangaroo Mother Care a lot, and then fathers feel left out. So Kangaroo Care has actually been a great introduction into neonatal care, because it also levels social circumstances. Because it can be done anywhere, even in a low socioeconomic environment. It can even be done in high to middle income countries, which is great. So all you need is a parent, basically a mother or a father, and the baby. So what happens is that you can use either the mother or the father, and we have skin to skin. So the mother will take off her clothes, waist up and farther, and then we'll also take off the baby's clothes, but only leave the nappy. And then we'll put the baby against the parent's skin, and then we'll let them, and then we'll cover them. There's a way we strap them in so that they don't drop the baby. And then with that, it's so beneficial for mother or father and baby. So for the baby, like you say, from the moment the mother delivers this baby, all they want to do is hold their baby. And unfortunately, with everything that's happening, we remove baby from mom. And then we put them in an incubator. There's connection. So there's that detachment, and there's distance between mother and child, which is unnatural. So Kangaroo Care restores that. So it lets mom and baby bond. And with that, for the mother, it calms her down, and the father. It helps to calm them down, because there's a lot of anxiety around your baby being in ICU. So just having your baby against your skin helps to calm you it helps to calm the baby.
Yeah.
So with the baby, it helps to regulate their temperature, because the best way to keep someone warm is with someone else's normal body temperature.
Yeah.
So it regulates baby's temperature.
Yeah.
It also then helps this baby to grow, because that's all we want the baby to grow, grow and get out of ICU.
Yeah.
So it helps the baby to grow. And then even now, being against the mother or father's skin, the flora and the good bacteria and microbiomes that we want the baby to have, they're on the skin, and the baby's being exposed to that.
Yeah.
And then for the parents, it also makes them feel like they're part of taking care of the baby. It feels like they're doing something very useful for the baby.
Yes.
Like I say, it regulates their nervous system. They're a bit more calm as well. And they actually feel like they have a purpose that they're serving in the ICU. And then for the mother specifically, that contact helps breast milk production. So having your baby against you helps them with their letdown reflex and milk being produced, and it tends to then help them. And with the fathers, it also makes them feel, because the mother carried the baby the whole time, and then now the baby's now in an incubator. So it's like the father never gets a chance to bond with the baby. So when the father then sits with the baby, then it also makes him feel like he's also part now, and bonding with his baby.
Child. Yeah. I love how you said that kangaroo care is the equalizer of social circumstances, because we don't have enough situations like that. You know, it's always like the haves will have, and their kids will do better, and they'll just survive, and everything will be rosy. And the people who have less tend to struggle. They don't always have access. But I love how you said that kangaroo care is the equalizer.
Everyone can do it.
What else can parents do? In terms of being involved in the neonatal ICU, so kangaroo care is a big thing. I mean, I always don't know when mothers say to me, I mean, what can I do? And I always say, pray for your baby, give me breast milk, and do kangaroo care when the time comes.
I think the most important thing that a mother or parents can do for the baby is be there. I think we underestimate the impact of present parents. If you look at two babies in ICU, where one, the parents were never there, they're all alone, and the one where the parents came, the ones where the parents came tend to do a little bit better than the other ones. So just having a mother stand next to that incubator does something for these prem babies. So their presence already, they've done a lot. And then secondly, yes, the kangaroo care, because that also, all the benefits that I've mentioned, it helps there. And then the liquid gold that the mother brings, the breast milk. I mean, that for us is amazing. That is everything. Like our eyes are wide open when we see that. So for the mothers bringing us breast milk is the best thing they can do for their baby. Because breast milk is the best milk, especially for all babies, especially for premature babies. And for the fathers, their presence also means a lot, because this is a long journey, and it's a difficult journey. So if a mother is there alone and she's hearing all these news, all these updates, all these ups and downs by herself, it's overwhelming. But when you have a partner who's there to support you, and you take breaks, you give each other breaks, you take chances. So their presence, if anything, means a lot. And also, a mother's instinct cannot be underestimated. So once a mother's standing there by the baby every day, even when there's small, subtle changes on the baby, they can notice even before we notice. So that motherly instinct has already kicked in, even though the baby's in the ICU. So when a mom says, I'm a bit worried, we actually, we also worry, and we take note of that concern that she's raised. So parents are a big part of our team when we're managing these babies.
Sure, that whole conversation just gave me goosebumps. Do you think there's emotional support do you think it's available? Do you think there's enough emotional support available to parents who are going through this NICU journey?
So unlike kangaroo care, that is the one where there is a bit of a difference when it comes to support. It depends where you've delivered, the volumes of the number of babies in the area where you've delivered. But there are some facilities that do have social worker support and psychology support. And those two things are very important for the parents, because as the physician, I take care of a baby. Yes, I give the mom updates, but unfortunately, I don't sit for an hour and ask the mom, how do you feel?
Yeah.
And that's when our psychology services come in handy. This is a long journey. It's filled with emotion.
Yeah.
And all I do is give it updates.
Yeah.
And when you have psychology services, they come in and give the mom the how are you.
Yeah.
And when we've given the mother news, we give the facts of what's happening. But it's good to have a psychology service that comes in after you've broken the news to sit with the mother and help her process.
Yeah.
Because you always need to be helped to process. It's a lot of things that you're hearing. Sometimes you don't know how to process, how to handle.
Yeah.
And then when you have psychology working hand in hand with you, with the parents, they help the parents to process all the emotions that they're going through. Because in all honesty, every mom wants to deliver, take their baby and go home.
Absolutely.
When things don't go like that, it then becomes a very difficult and emotional journey for the parents. So you need someone who comes in to help.
Yeah.
And then a premature baby, when they're going home, they're also going to need a lot of help.
Yeah.
And that's where the social worker services come in to try and assist the home circumstances now of this baby. So those two, in some facilities it's running, it's functional, which is great. And then in some facilities they could do a little bit better with having psychology services actually ready available in the units.
Yeah, I think that was my next question, because I think often I don't think that it's readily enough, you know, for how much it's needed, for how traumatic that entire experience can be, and for how that trauma often persists beyond your time in the ICU. You know, your child will go home, you know, and you get home and you can still hear the machines. The number of times I struggled with still hearing the machines and hearing the beeping of the machines. And even mothers today will still tell me, just walking into the hospital to come for a general well check when your baby is not sick is still so triggering and so upsetting for them, you know. And I mean, there's also a lot of parents that are scared of their babies for a long time because you cannot get that picture of this tiny, fragile, flimsy human being out of your brain, right? How do you help them with that? How do you help them? You know, I'm sure you get baby mothers and parents that say, you know, I'm scared of my child, you know, and that obviously is going to impact breast milk. Like you said, it's going to impact bonding and the mental and emotional wellness of the mother and of the father, you know, and probably the child in the long term. But how do you assist them with that? How do you support that early bonding in parents who are terrified? Because I'm sure a lot of them are.
Yeah. No, a lot of parents are terrified because the whole delivery is traumatic.
Yeah.
Because a pregnancy that's going well will see itself to completion and the baby will be born term.
Yes.
You'll take your baby and you'll go home.
Yeah.
So usually when a baby is born premature, there was something that was wrong that made this baby disembark that flight so early.
Yeah.
So there's either the mom wasn't well, she wasn't okay, or the baby wasn't okay. So already what happened around is traumatic for this mother.
Yeah.
And then the next thing with every mother, all they want is, how's my baby? Before they even worry about themselves. But now the pediatrician has taken the baby and they're gone with the baby. So firstly, when the mothers come in, the first thing they need is reassurance that their baby is alive and their baby is somewhere. Just finding the baby brings anxiety. And then once they have their baby, some of them are scared by the size of the baby.
Yeah.
They don't want to touch the baby. So what we do for them is we ease them into it. The first few days, some mothers, all they can do is stand there and stare at the baby. And they can't touch, they can't. So we'll let the mom ease herself into it. So for the mom who's so scared, she can't even touch the baby, we might, let's say we've started feeding the baby, we'll let her hold the syringe.
Sure.
Just hold the syringe because she's so scared to touch the baby. Just let her hold the syringe while the feed is running in. Already she feels like now she's part of it.
She's doing something.
And then from there, then we teach her gentle ways of touching a baby, because there's ways you must touch these babies. You don't just hold them and shake them and no. So we'll teach them gentle ways of touching the baby. So we'll first say, just put your finger in the baby's hand And then as she puts her finger there, then the baby holds onto her finger. And then she'll move from that. We'll teach her, cup your baby's head. And then once they're doing that, then you're easing her into it. And then she actually will start stroking her baby. And then slowly as the days will go, then we'll move her to kangaroo care. Once she's ready now, then we'll then teach her how to change a nappy. Then, so we ease them into it. But for most moms, we start at, all she could do was stand there and stare at the baby. But we tell them that your presence means a lot, because just coming there and standing there, your baby knows you're there. Stand there and talk to your baby and tell them, I'm here. Even for the fathers, it takes even longer sometimes, because they feel like they're going to break the baby. They're going to, so for them, you really have to reassure them. You have to first let mom hold the baby. Then he sees, okay, mom didn't break the baby. And then you'll ease him. And then you'll ease him into, okay, now you hold the baby. Okay, then as you move, then you'll let him do some kangaroo care. But it's simple things like that, from just holding the syringe. And not allowing them to detach. Because the moment you allow mom to be so scared and leave, that initiation of that bonding is very difficult, because there's a lot of trauma around the situation. So the sooner you can let them connect and bond, the better it is for them.
So I love what you said about dads, right? Because I think dads always have such a special place in my heart because of how misunderstood they often are, right? And I always say that we, from the moment you find out you are pregnant, you somewhat start becoming a mother. You know, your brain prepares, your body prepares. You are already kind of, the mothering is set in motion. Fathers become fathers the moment they see their child. So yes, there's the sonar and it's cute and there's heartbeats and we're happy and we see the gender of the baby. But fathers become fathers when the child is born. I really believe that instinct truly kicks in the moment you see this human being, right? But then this human being is this small, hardly developed, very scary looking, attached to wires and monitors, can't even feed for themselves. You know, I think that it's not surprising to me that fathers really struggle.
And I mean, some of our fathers have big muscles, big hands, and they're looking at themselves in relation to the size of the baby.
The size of the child.
So they do worry that they're going to break their babies.
So I think in terms of the support, we need to do better by our dads. You know, I think it needs to be less stigmatized, less scary.
Definitely.
This whole experience. I think mothers are also a little bit just kind of more tuned into it.
And they are more present. But what we also try and do is, I have sometimes on weekends, when I'm on call, I'll say it's Dad's Day. And on that day, mom has been coming the whole week. Dad, I mean, he doesn't get maternity leave, so he goes back to work. So he'll come on a weekend. So I'll say, mom has been here the whole week. So on Sunday, it's Dad's Day, and all dads kangaroo care. So and then moms feel a bit aggrieved on that day. But I'm like, but you've been here the whole week. So sort of like trying to make it, show the dad that you're part of this. Because if you don't let them, they will safely sit in the corner and be like, no, mom's got it. She can keep going with it. She can keep going with it. I think she does it better. But if you make it like Dad's Day, then on that day in your unit, all dads are doing kangaroo care.
And they love it, right?
They do. And then you see them beaming, like the look on their face. Initially, you can see they're tensing their bodies when you put the baby, but the connection is beautiful once they've done it.
I love that. I love Dad's Day. So the journey, the prematurity life doesn't end the moment you leave the hospital, unfortunately.
No.
So what are the complications? What happens afterwards? What now?
Sure. Prematurity, like we've mentioned in our conversation, is immature organs coming out of the womb, and this baby must try and survive. So with that, trying to get an organ that wasn't fully formed, it will come with dysfunctions of that organ. Some things resolve and some things persist. And prematurity is lifelong, unfortunately. So a a child never forgets they were premature because they will carry one or other complication from their prematurity. Some are more severe than others. So if we take it from the one that give us the biggest or the most gray hair, which is the lungs, some babies will progress to then becoming chronic lung. We call them having a condition called chronic lung disease, where their lung issues then persist. And then with that, some may come off oxygen, some don't. So for those who don't come off, it means going home now with oxygen. And then now we're involving another specialist who's going to take care of your lungs. So then you'll have follow-ups with that specialist until you are then hopefully able to come off the oxygen. While we're treating the babies with oxygen, the oxygen also affects their eyes. Some have vision problems. So yes, great, we managed to get you out of the ICU, but your eyes are affected a bit and to different degrees. And some babies will then need ophthalmology follow-ups to be watching their eyes. There may be some who will need some aid, some spectacles.
At least they make the spectacles really cute.
Yes, they are cute and nice colors. And very nice colors. So then some will have the retinopathy of prematurity. And then some feeding problems persist and different feeding issues. So some will have sensory neural issues where it's not liking certain textures. They don't want to eat certain things. So feeding becomes a problem. And remember, they were born at a low birth weight. So the most important thing we're trying to do for them is that they must gain weight. And then some feeding issues persist. They struggle to feed. So the dietitian is always involved in their life. The speech therapists are involved in their life. And then some who are born, unfortunately, premature and a heart problem will then have to continue with the cardiologist to follow up. So basically taking care of a prem baby is what we call a multidisciplinary team approach to this baby. Because some things end in the NICU, some things continue out of the NICU. And with that, the baby has a structured follow-up. So they have a follow-up primarily with the pediatrician or neonatologist who's seen them once they come out of the NICU. And all other complications that they have, they also have that specialist also on board, following them up and seeing them as well. So they have a whole team that takes care of them. And then some will need some physio, depending on how they're moving, their muscles, how they're walking. They'll need physio, they'll need occupational therapy. So they need a whole team backing them up, basically. And then the ongoing psychology as well, support. So the social worker, psychology. So psychology goes on to support these prem moms, because now it's the fear of going home with the baby. And then the social worker is, we have a great neonatal ICU environment, but we must now take you to a safe home environment. And that's where our social workers then come in. So it's like a whole team.
And that's when life begins, right? Life begins when you go home with your baby. Like I always remind parents that this is not life. You coming here every day and seeing your baby and then going home without them is not life. So it always, just to encourage them, I always just say, you know, think of it as how now your life with your baby begins, you know, and there's all this bad stuff, the scary stuff that's happened. But now you can truly begin to raise your child.
Bond and be home where you're supposed to be.
Okay. So if you could give parents one message, you know, as a doctor who treats premature babies and their families every single day, what would you say to parents about this journey, and what kind of message of hope would you like to leave them with?
So I think, firstly, I'd like parents to know that prem babies are superheroes. They are superheroes because there's no resilience like the resilience of a prem baby. We like to say, if you want to see how much strength is in a prem baby, try and put up a drip on them. They have the biggest grip ever. They can be 1 kilogram but so strong. So know that you've given birth to one of the strongest human beings you'll ever meet in your life. And then for the parents who are the parents to the superhero, they are also super parents. I mean, all parents are superheroes, but the ones who deliver a prem baby are on another level. So already they must know that they have the strength before even the journey begins. And then I would say the journey is like going on a roller coaster.
Yeah.
So you're going on a roller coaster ride.
Yeah.
And buckle up.
Yeah.
Basically.
But like a broken old one where the nails are rusty and it's making
and
funny sounds.
Things click and things sound like they're going loose.
And the seatbelt's not always working.
Yes, and the seatbelt, you might have to hold it as well. So it is a roller coaster ride.
Yeah.
Brace yourself and buckle up because there are highs where we are celebrating when you walk in and we're telling you great news, and there are lows. And in the lows, just when you think we're just going low, we twist as well and turn you upside down. Because in the lows, sometimes we tell you things like, we don't know if your baby's going to make it through the night. And then even in that night, we might throw in, we might go for surgery. So it's like, even in the low, when you think they've told you the worst, we can even still tell you more.
Lower.
We can go lower. And there are days when we take one step forward and then we take 10 back. You think we are at 5 mils, then your baby vomits it all out. And then we're actually saying, no, we're going to rest him a bit. And then, oh, actually, no, we're going to theater, actually. So it's filled with emotions, ups and downs. Some parents say the walk to NICU is the worst thing they have to do every day, because they don't know when they walk into that room, what am I going to say to them? And they don't know if it's going to be good or bad news. They're not sure. So it's a roller coaster. Buckle up and then pack all your strength before you get onto this roller coaster. You need to pack whatever you do to keep yourself going. So have your partner in the seat next to you, because you're going to go through this together. Have your family members who can support you, be there for you. Have your pastor, if you have someone who prays with you, there with you. But the one thing along the journey you need to do is stay positive. Because with every roller coaster, it doesn't go on forever. At some point, it's going to stop. And then you're going to realize, oh, okay, we didn't fall off. We didn't fall off. So with every day that you come, stay positive. No matter how hard it is, no matter how sometimes you feel like you're losing hope, it's okay to lose hope at points. And at that time, take a break. Take a break. Take a day and don't come to ICU that day. Take a break, recharge your batteries and come back. So you're gonna ride through all of those emotions. You're gonna have to stay strong, because you've got the superheroes this superhero in ICU is fighting every day. So you're gonna be there fighting with this baby. And you must stay in the fight. Stay in the fight with your baby, because they don't give up. So stay in the fight with the baby. And with everything that comes at you, keep your eye on the prize, which is going home with your baby. Because that's the ultimate prize, to see your baby going home. So no matter what is going on, believe that someday you're going to go home with your baby. And remember that no one is working against you or fighting with you. The NICU journey is a team, and everyone in that team is important, including parents. So the doctors want your baby to be as home as much as you want your baby to be home. So if you work together with the physicians, the OT, everybody who's coming to see your baby, then all of that helps you to see that you're part of a team that wants your baby to win. So working together and realizing how important you are in that team also helps you to keep going.
Sure.
So it's a long, difficult journey. But stay strong and stay in it.
Sure. Well, there you have it. Prematurity can feel like the scariest start to parenting your child. But it's also a story of strength, of resilience, of bravery, of tiny humans showing us miraculous things. Thank you so much, Sandra, for joining us for that incredible episode. To every parent listening, you didn't cause this. It's not your fault, and you're not alone. Thank you so much for joining us today for Tiny Matters with Dr. K. Until the next time, stay kind and stay curious.